think what URA offers the patient or couple with infertility is the most available options and the most fair explanation of all of those options. We don't push people into a particular treatment. We don't push everyone into IVF. We don't push everyone away from IVF.
We don't use cookie cutter protocols. Every couple that walks in the door, every patient that walks in the door is unique. So I really think that when patients see us, they feel like they're not walking through an in vitro fertilization mill. They feel like they're getting really very individualized care from the physicians.
The physicians at University Reproductive Associates strive for excellence in patient care, but we all recognize our role in training the next generation of physicians and specialists in reproductive endocrinology and infertility. All of the physicians at University Reproductive Associates are actively involved in teaching the fellows, the residents, and also medical students at Rutgers, New Jersey Medical School.
As one of a select few centers in the country that are allowed to train reproductive endocrinology and infertility fellows, at URA we really are on the cutting edge of education and teaching. We're the training site for 2 different residencies, soon to be 3.
At an academically oriented REI practice, we not only have the benefit of being able to teach others, so teaching the next generation of how to become successful doctors, but we also have the benefit of keeping up to date with new technology and new research ideas. We practice evidence-based medicine as a result of being an academic affiliated practice. And as a result, the patients get the most evidence-based practice and the most evidence-based treatments.
IVF is not the only option for helping a couple achieve pregnancy. There are a number of options, and the option that we choose with the patient depends on what the issue is that's preventing them from achieving a pregnancy. So if we have a couple that in which both fallopian tubes are blocked, for example, that is an indication for IVF. But if we have a couple in which the woman is simply not ovulating, but everything else is in place, tubes are open, sperm is normal, uterus is without any issues, then it may be something as simple as taking an oral medication to induce ovulation and time that with intercourse.
Was a patient who went through IVF, and they always had thin linings. And they went to doctor after doctor, and they said, oh, you just need more estrogen, more estrogen. But turns out she was forming antibody to her own body's estrogen. And when I sent her to an immunologist to calm her autoimmune diseases down, she got pregnant naturally 3 months later.
URA is the only fertility group in the area offering robotic surgery to patients utilizing the Da Vinci surgical robot.
Very few reproductive endocrinologists do robotic surgery, but we're able to offer that in our practice. To be trained in robotic surgery, you have to do a lot of cases. We're all trained in laparoscopic surgery, but when we do robotic surgery, it adds another dimension to our ability to be precise and to do better surgery. The robot gives the surgeon wrists. When you're doing laparoscopic surgery, you're doing this and you're operating and you're holding things like this. But when you're doing robotics, you can turn your wrist.
The LifeAir technology is really a game changer in the in vitro fertilization embryology laboratory. It's using ultraviolet light and a whole variety of technologies to really give you pretty much nothing but pure clean air. And that allows you to have the best possible incubator environment for your embryos to grow. And that gives you better embryos, better quality embryos, gives you better pregnancy rates. We're proud to be the first center in New Jersey to offer this technology.
Part of the initial evaluation for a couple coming to URA for fertility care involves testing the partner's sperm. This is of critical importance because the quality of the sperm and the amount of sperm will in many ways dictate what the best treatment options may be for the patient. In cases of mild male factor infertility, where some aspects of the sperm count or the sperm motility may be a bit lower than normal, we can attempt to achieve pregnancy through the use of artificial insemination, or what we call intrauterine insemination, where we give the sperm a little bit of a head start in getting into the uterus and close to the tubes.
URA was the first program in New Jersey to have a birth through a donor gamete, and we continue to provide this service for all couples. In LGBT population, since we help you coordinate in getting either the gametes are the sperm or egg, or some, and for example, same-sex female couples will help you in sorting through either using donor sperm, either someone's known or anonymous, and in a same-sex male couple will not help you get donor eggs and also help you in finding a carrier for the pregnancy.